Hi there, my name is Katie Monaco. I'm a registered nurse and nursing student at Indiana State University, and this is a health education program for Nursing 444 Community Health Nursing. This presentation will discuss health disparities associated with low socioeconomic status population while focusing specifically on the increased prevalence of COPD and COPD associated disparities seen in these low socioeconomic status communities. By the end of this presentation, readers will be able to define COPD, identify factors contributing to COPD and COPD-associated health disparities, recognize the signs and symptoms of COPD, explain how COPD in people of lower socioeconomic status relates to health disparities, recognize prevention efforts most appropriate for low socioeconomic status individuals living with COPD, discuss organizational strategies that exist for health disparities associated with COPD and low socioeconomic status, discuss long-term management options available for people living with COPD, and lastly, recognize risks associated with COPD health disparities during this time of COVID-19. Before we begin, please click the link provided below to take the 10-question pretest. Before we get started, some share-worthy statistics that I found include COPD being the leading cause of death in the United States, affecting more than 16 million Americans. 85 to 90% of all COPD cases are caused by cigarette smoking. According to the American Lung Association, when a cigarette burns, it creates more than 7,000 chemicals. The toxins in cigarette smoke weaken your lungs' defense against infections, narrow air passages, cause swelling in air tubules, and destroy the air sacs, all of which are contributing factors for COPD. In addition, low socioeconomic status populations account for roughly 2/3 of all diagnosed cases of COPD in the United States. And according to the World Health Organization, more than 90% of COPD-related deaths occur in both low and middle-income communities. So what is COPD? COPD stands for chronic obstructive pulmonary disease. It is chronic inflammation of the lungs. It is a disease that progressively worsens over time, causing blockage of airflow from the lungs and respiratory problems. There are two common conditions contributing to COPD, that of which are emphysema and chronic bronchitis. Emphysema is the destruction of alveoli at the end of the bronchioles, your small air passages in the lungs. This is caused by exposure to pollutants such as cigarette smoke and other irritating gases. Chronic bronchitis is the inflammation of bronchial tube linings that carries air to and from the alveoli of the lungs. It is associated with daily cough and excess mucus production. Risk factors and causes of COPD include smoking, your environment, genetic factors, and chronic respiratory infections, to name a few. As I mentioned earlier, 85 to 90% of COPD cases are caused by smoking, according to the American Lung Association. Tobacco smoke is a key factor for the development and progression of COPD in the United States. Exposures to air pollutants at home, work, and outdoors, or working with chemicals, dust, and fumes, as well as the inhalation of secondhand smoke, are also environmental factors contributing to COPD development. Genetic factors such as alpha-1 deficiency related emphysema can also contribute, and this is an inherited condition that affects the body's ability to produce lung-protecting protein called alpha-1. And lastly, chronic respiratory infections such as chronic bronchitis, emphysema, or a history of childhood respiratory infections over time leads to the development of COPD. In terms of signs and symptoms related to COPD, these can be tricky as symptoms of COPD are often not recognized until the later stages of the disease. Many people attribute new onset shortness of breath or decreased ability to perform normal activities to the normal process of aging. It is important to note that shortness of breath is an important symptom of any lung disease. COPD is also associated with chronic cough, frequent respiratory infections, blueness around the lips or nails, also known as cyanosis, increasing fatigue, increased production of mucus or phlegm with cough, as well as wheezing. This slide will explain why COPD in low socioeconomic populations is a community health issue. Socioeconomic status is defined by a multifactorial assessment of one's economic and social position in society based on factors such as income, occupation, residential environment, and educational achievements. Multiple socioeconomic factors contribute to health disparities associated with chronic diseases. Populations of low socioeconomic status are 14 times more likely to have respiratory disease. This is due to environmental risk factors being more common in low-income communities for respiratory illness. There is a strong relationship between socioeconomic status and COPD, as many of the COPD's contributing factors are likely to be present in these communities. This includes frequent use of tobacco products, occupational exposure to pollutants, prenatal and childhood exposures to pollutants and secondhand smoke, frequent respiratory tract infections as a result of these exposures, and poor residential housing conditions. Smoking and environment play leading roles in COPD and lung disease development. And unfortunately, low socioeconomic status communities have greater exposures to both of these factors. In order for COPD prevention strategies to be effective in low socioeconomic communities, primary prevention interventions and strategies would be the most effective. However, primary prevention strategies for COPD through the avoidance of exposure to inhalants and toxins, although would have the most impact on this population, it is difficult to achieve in the disadvantaged group. Strategies and interventions are necessary to target low socioeconomic communities by improving housing conditions, providing education on tobacco, beginning at people with a young age, reducing tobacco use, and reducing other damaging environmental exposures. However, these interventions are not often implemented, as they require combined societal change and efforts with healthcare providers and public health in order to be successful. To have an impact on tobacco use in low socioeconomic populations, it too requires societal changes and efforts by healthcare organizations. Furthermore, due to low literacy levels, this impacts the health status of people in these low socioeconomic communities. Education about COPD and its risk factors should be culturally sensitive and be delivered at the appropriate education level for the target population. In this slide here, I have included some organizations and their strategies that they have implemented for health disparities associated with COPD and low socioeconomic status communities. The American Thoracic Society has developed a strategy and group called the Lung Corps. This is to reduce health disparities through the promotion of research, training, disseminating best practices, and monitoring and advocating for lung health to the public. The American Thoracic Society concludes that the attainment of respiratory health issues in this population necessitates multidisciplinary efforts in order to target a wide range of health disparities. Furthermore, the World Health Organization has created an annual medication list, which includes basic drug therapies relevant to the acute and chronic management of COPD. Individuals belonging to low socioeconomic groups often face significant challenges in accessing, paying for, and adhering to COPD medications due to their disparities. Limited income causes forced choices between purchasing basic living necessities and COPD medications. At the individual level, some tips for managing COPD include protecting your lungs, protecting your health, and developing a COPD management plan. Protect your lungs by avoiding known respiratory triggers and smoking cessation. You also want to avoid secondhand smoke if possible. Protect your health against common cold and respiratory illness by washing your hands often, avoiding crowds during peak illness season such as flu season or in this case coronavirus outbreak. Always practice good hygiene and get vaccinated against flu and pneumonia if available. Work with your healthcare provider to make a plan for when and how to take your medications and when to seek medical attention in the event that you're not able to manage COPD on your own. An example of COPD management plan can be found at the link provided in the slide. Continuing from the previous slide, you want to implement changes in your dietary and nutritional habits. You may be wondering how food relates to breathing. The process of changing food to fuel in the body is called metabolism. Oxygen and food are the raw materials of this process, and energy and carbon dioxide are the finished products. The right mix of nutrients in your diet can help you breathe easier. You want to choose complex carbohydrates in your diet, such as whole grain, bread and pasta, fresh fruits, and vegetables. Try to consume 20 to 30 grams of fiber each day and limit foods that contain trans fats and saturated fats. In addition, limit your sodium intake as excess sodium can cause increases in swelling and troubles with breathing. Furthermore, increase your fluid intake and aim to drink 6 to 8 glasses of water each day. In relation to current events and COVID-19, it's important to always keep chronic lung disease well controlled for your overall health and especially during peak times of infection such as now. Low socioeconomic communities may be more likely to have higher levels of air pollution, which has been shown to increase susceptibility to COVID-19. Furthermore, long-term exposure to air pollution can worsen symptoms of lung disease and also increase susceptibility to lung infection. And there's new evidence about air pollution and COVID-19 and its prevalences. Lastly, people with chronic lung disease are more susceptible to severe complications if they do contract COVID-19. Now that my presentation is complete, please click the link below to show me what you've learned by taking the 10-question post test.